Hi, welcome back to Rohrich Knows Podcast, helping you become a better you. I'm Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas, and we're going to talk about a very hot topic, and I think everybody is on it. In fact, as a plastic surgeon, I have to make sure I ask every patient about it. And I'm joined today by David Weir, who's my amazing nurse practitioner, and because of him, actually, I actually started getting my patients on semiglutides. So, but why are people on semiglutides, and is it really something that's safe to do? And also, how does it interact with plastic surgery? Or better yet, I mean, if you're on it, should you have plastic surgery, at least any surgical procedure? So David, tell us a little bit about semiglutides, and we know that they've been used for a long time in pre-diabetics, and now it's all the rage. In fact, people are on it more than they are on antidepressants.
Yeah, so semaglutide are these, let's just say, weight loss drugs in general, have kind of made an incredible resurgence over the past 2 years. You know, these medications work in different ways, including decreasing your appetite because it slows down
gastric
emptying. It also makes your body utilize and produce insulin more efficiently.
Right.
And I think Americans, I mean, you know, we tend to eat a lot out. We eat a lot of fast food. We don't
40%
we don't
overweight.
walk as much as we're supposed to, or we don't diet and exercise like we're supposed to. And I think the average American at some point ends up being pre-diabetic at some point in their life. Okay?
Right.
So these medications have been used to treat diabetes for decades.
Well, yes.
They're not new. It's just when they started looking at the data and extrapolating it from the safety studies for diabetes, not only was it helping with glycemic control or blood sugar control, these patients were losing weight and they weren't doing anything else.
Right.
So, you know, some of the claims with like semaglutide, I think in their study is a 10% body weight reduction, okay, over the course of a year, and that's without diet and exercise. That's just the once weekly injection. And then you have the GLP-1s and 2s like tirzepatide,
Right.
that works in 2 different pathways, that they're losing up to 20% of their body weight over the course of the year without actually doing diet or exercise. So, you know, I think it's a great drug for patients who have been struggling with their weight. Okay?
But who are significantly overweight.
Significantly overweight,
Right.
absolutely.
But even though I can tell you in my practice, I have a lot of patients that shouldn't be on it, and they're on it, and you have to ask them. And so I think it is cardioprotective. I mean, that's a very good thing. And of course, in the pre-diabetic patient, it's really good. It enhances your ability for insulin use. And it's been used a long time. I mean, I had one of my colleagues on recently who's a diabetologist, and of course he uses it. He's used it for a long time in his patients. But the problems are, if you don't incorporate diet and exercise in it, when you get off of it, the recidivation, the rate of getting your weight back is high.
It's very high. So I do prescribe these in our practice.
Yeah.
And
tell us about how we do that. And I refer you patients that are significantly overweight, 20, 30% overweight, that have tried everything.
Well, yeah, they've tried everything, or they are starting their health journey. You know, I tell patients, like, you didn't gain 50 pounds overnight.
No.
You're not going to lose it overnight.
Right.
And I mean, in the world of Amazon that we live in, if I can't get it the same day or next day, I'm going to be dissatisfied, you know?
Right.
So I think these medications are nice for our patients because it kind of gives them that kind of jump start, so they see results faster. They have a decreased appetite, because the caveat to, if you go from a sedentary lifestyle to doing increased diet, increased exercises, you're typically starving all the time.
Right.
And these medications help to control your appetite, where you're not relying on food as much. So I think for the right patient, I think it absolutely works. I think the way it works in the plastic surgery practice is that we have a lot of patients come in that want liposuction, okay?
Right.
And liposuction would be great, but they still need to lose 20 or 30 pounds before it's even safe to perform liposuction on them.
And the good thing about that, David, was before people, and I wouldn't do it, but you'd say, you got to lose 20, 30 pounds. And guess what? You never saw them again because somebody else in the city would operate on them and do liposuction, which, you know, liposuction isn't a weight loss surgical procedure. It's something you can do to shape and improve your contour. So now you can say, all right, I'm going to have you see David, and you're going to lose 20, 30 pounds, and then we'll operate on you. Just like I had a patient recently I sent to you that wanted to lose 40 pounds before her facelift. I said, well, we've got to do that before you have your facelift.
I think that's a really important note that you mentioned there is, I when I'm coaching patients on their weight loss journey, or we share patients because you do surgery on them, if they are a heavier patient and they're wanting to lose weight, it's very important to lose the weight and then have your surgery. The worst thing that you can do, in my opinion, is to be obese, get your facelift, and then lose 40 pounds because you're going to need another facelift.
Right.
It's just because you will lose volume all over. And my grandma used to tell me this, and I didn't know what it meant, is you can choose your face or you can choose your waist. Okay. Skinny people don't age well. They just don't. They lose so much volume in their face. They look more gaunt, so they look more aged. So, with these patients that are used to being carrying around a little bit more weight than they should, if they have surgery and then they lose weight, it kind of alters their result, just because they're losing so much volume that they're getting recurrent skin laxity that that wasn't there before. And on the flip side, I have a lot of very mature patients that are in their 70s or 80s, and they're coming in for revolumization, and I'm putting buckets of filler in them because they have no fat anywhere. And I tell them, you need to gain 5 pounds. Eat burgers, eat pizza, drink protein shakes. You need to gain 5 pounds. It would be cheaper than the 10 syringes of filler I'm going to have to put in your face.
Right.
So I think it works both ways.
Yeah.
But I think these medications are a nice caveat to help someone on their journey for weight loss, but it's not a Band-Aid. It's not going to fix everything.
No, and I think the semaglutides, if you understand the medication and you use it appropriately and you monitor it, and you're monitoring these patients, you're seeing these patients, and then you're saying, hey, you need to change your lifestyle, diet, and everything else, and then you, within that 10% of where you need your body, then you should and can have plastic surgery that is actually very powerful versus doing it and then you lose 20, 30 pounds or gain it.
Right.
And the other thing is, if you're going to have plastic surgery, you must tell your plastic surgeon that you're on a semaglutide, Ozempic, or whatever one you're on. You must stop it 2 weeks before, because if you don't, you have delayed gastric emptying, and you can have some problems with anesthesia, awakening, and aspiration, and things like that. So I'll tell you, it's very important to know before you go and do that. So leave me your comments about semaglutides. Are you on it? Would you like to hear more about it? And David, what are the 3 things you tell our patients that it's not a fix, it's not a cure?
It's not a fix. It's not an overnight success story. It takes work.
Yeah.
Okay.
It's a catalyst.
It's a catalyst. And while you're on it, you need to fix your habits.
Right.
And it's a great drug that you can use to help correct some habits, whether you're not eating correctly. Because I have patients that won't eat all day and then they eat 5,000 calories right before they go to bed. Okay?
Right.
And with these drugs, you can't do that. I mean, with the delayed gastric emptying, it will make you sick.
Right. In fact, if you're on it, you shouldn't be eating probably for 3 hours before you go to bed because you delay gastric emptying. And sometimes the gastric emptying is delayed for a week or so.
For a week or so, yeah. So I think, again, it's not a fix, but it is a caveat to help some of our patients that have struggled with their weight to lose it more effectively, more efficiently, and help control and help change some of the habits that they might have gotten while they were gaining weight.
Right. Well, wise words from David. And know before you go, if you have any questions or comments, leave them for me on my DM. And till next time, helping you become a better you.